Now to a vaccine alert for children under the age of 11. Pfizer just announced today that its COVID-19 vaccine is safe and effective for children between the ages of 5 and 11. The company says the data shows children develop coronavirus fighting antibodies on a level equal to teenagers and young adults after a 2-shot regimen. The dosages used in those shots, about a third of what's given to adults. Pfizer now plans to seek approval from U.S. regulators to begin offering vaccinations to children in that age group. Meanwhile, Virginia getting ready for that next step as COVID-19 hospitalizations among children are rising in the metro Richmond area. Health leaders are hopeful we could see final approval and rollout sometime next month. Henry Graff with our vaccine team is live downtown with details. Henry?
Kirk, good evening. Yeah, the state's vaccine coordinator tells me they have a plan in place once that approval comes. And pediatricians I spoke with in this area also hopeful that that approval for this next age group will lower the number of COVID-19 cases in children. The state is anxiously awaiting approval of Pfizer's COVID-19 vaccine for hundreds of thousands of children, readying for a potential rollout in Virginia sometime next month.
We have been preparing for this inevitability. We actually thought it might come a little bit sooner. There are a few different avenues that we're taking to ensure that we've got the capacity we need.
Pfizer says a low dose of its vaccine is safe for children between the ages of 5 and 11. Once reviews and approvals are completed at the federal level, the state health department will move forward with its plan.
So what Pfizer has done is to select a dose that they want to see optimize the immune response, but minimize any potential side effects. So 10 micrograms appears to be that sweet spot where we can expect to see a good immune response, but also have a positive safety profile for kids in this age group.
In Virginia, about 723,000 children fall into the 5 to 11 age group. In Richmond and Henrico, that number stands at around 48,000.
This is really exciting news for all of the pediatricians across the country. And as a parent too, of a child in this age group, I'm also just personally excited about the potential to be vaccinating him, hopefully in the not too distant future.
When approval comes, the state says parents can seek out that COVID-19 vaccine shot in a variety of ways, mainly pharmacies and health department vaccine clinics. Dr. Avula says they will open a number of larger clinics across the state in the coming weeks to deal with demand and hope to take some stress off pediatric doctors.
I don't think I've ever seen a time where both the public health infrastructure and the healthcare infrastructure have been under such duress.
Back out here live, VCU tells me they are seeing more cases of COVID-19 within children inside hospitals right now, though the hospitalization rate is not increasing too much at this point in time. A spokesperson telling me as well they are not in as dire of a situation as other hospitals in other states at this point in time, but also saying this next approval certainly couldn't come faster. Live and on your side tonight here in downtown Richmond, I'm Henry Graff, NBC 12 News.